Okay, we'll go ahead and get started. This is Jenny Hill with the Indiana Rural Health Association. We have myself here today along with Shannon and Julia from ASPIN. And I also have Matt Sesnick here with me from FSSA presenting on some HIP information. Go ahead and start off with ASPIN's presentation, just some information on Marketplace, along with some updates where we're at right now and where we're going. And I'll let Shannon take over from here.
Hi, everyone. This is Shannon Holloway Sargent. I'm with ASPIN. So first of all, of course, even though open enrollment for 2015 coverage ended February 15th, your clients can actually still enroll possibly in a special enrollment period. You'll go ahead and go to the next slide. So we created this little fun tagline that we're trying to use when we talk to consumers out in different settings. Found yourself having to pay a tax penalty for not having insurance in 2014. So on Friday, February the 20th, CMS announced that there was going to be a special enrollment period for individuals and families in states that use the federally facilitated marketplace that did not have health coverage in 2014 and are subject to the fee or shared responsibility payment when they filed their 2014 taxes. So these are some of the folks that we've been trying to reach out to. We've teamed up with some different VITA sites. We've spoke to H&R Blocks and different tax preparers, trying to make sure that they are informed of this option that consumers can use. So we just want to make sure that you guys are also aware of it. So this special enrollment period is going to allow individuals and families who were unaware, didn't understand the implications of the new requirement to enroll in the health insurance coverage through the federally facilitated marketplace. And the special enrollment period is actually going to begin this next week on March 15th, and it ends April 30th. And go ahead and go to the next slide. So we want to make sure that everyone is clear on what the eligibility is for that special enrollment period. So they must live in a state that's a federally facilitated marketplace, which Indiana is, and they are not aware of the ACA requirements to maintain minimum essential coverage, and they are subject to paying the penalty for their 2014 taxes, and they are not currently enrolled in 2015 coverage through the marketplace or another minimum essential coverage. And you can go ahead to the next slide. So we want to make sure that everyone also knows that they can still get coverage in other ways besides the tax special enrollment period. If you have a life change that gives you a special enrollment period, or if you qualify for Medicaid and CHIP, and I know we've got someone from FSSA that's going to speak a little bit more about that and HIP. But there is this screener tool we wanted to make sure that you've seen or may want to pass this out amongst your staff. That's on healthcare.gov/screener tool. Please make sure that you know that anyone that uses this tool, they still wouldn't need to actually fill out an application to confirm that that SEP is going to apply to them. So this is just a great tool to have to kind of give someone the ideas if they may be eligible or not for a special enrollment period. And go ahead to the next slide. Of course, we are one of your options for finding local help. We have navigators with mobile offices, so they can go lots of different places throughout the state. We have our call center, which I actually am the main answerer of that. So I answer a lot of questions. We do get a lot of questions from consumers, how to use their insurance. And so that's another thing that we can actually do too, is we're creating some presentations so that we can actually assist consumers after they've enrolled in their insurance, and if they have follow-up questions, preparing for a visit to the doctor, making appointments, what they need to bring with them. So we are prepared to assist consumers even after they have enrolled. And of course, they can call our call center to set up appointments and go through our website. You know, if they think of this, of course, in the middle of the night, they can do an online submission to our website for an appointment. And then, of course, this is our information about our grant that we always present at the end, and that's our presentation.
This is Ann at the Family Health and Health Center.
Yes.
Go ahead.
Yes, if someone were, for instance, to change jobs and their job had insurance and they're going to lose insurance, could they enroll during this special enrollment time?
Absolutely, yes. They would be eligible for a special enrollment period.
But it wouldn't just be this special enrollment period. They could enroll at any time during the year. So if they lost their job in August, that would qualify them for a special enrollment period.
Well, I had heard that, but I had never read it anywhere, so I just wanted to make sure.
Yes.
If anyone has any questions or requests regarding what can be sent to them literature-wise, ASPIN has plenty of that they can send you. And I know that Matt said he has plenty of HIP information that can be sent. So just please email me at jhill@indianarha.org, and I will have my contact information along with Matt and Shannon's at the end of the presentation here. And so the next slides that you're going to see here is based on our HIP right now for the state of Indiana, HIP 2.0, that was recently approved. And Matt Sesnick from FSSA is going to cover those slides for you.
Hi, thanks for inviting me. My name is Matt Chesnick, and I'm the Eligibility Director for the Office of Medicaid Policy and Planning. And so I'm going to try to give some basic information about HIP 2.0. My focus is eligibility, so if you do have questions that I can't answer that may be more specific about provider issues or benefits, I'll definitely take those questions back with me, try to get answers for you. Just I want to make sure in this presentation that I do cover all the different plan options, HIP Basic, HIP Plus, the HIP State Plan, and what cost sharing requirements individuals will have, and then the different benefits between the different packages. Some of these slides are rather basic and may repeat several times. So this is some basic terminology I'm sure you're all familiar with. I just want to point out the federal poverty levels is very important here because for HIP Basic and HIP Plus, we have to look at the 100% poverty level to see if individuals that do not pay a monthly contribution, they would default to the basic HIP plan if they're under 100% of the poverty level. But individuals above that 100% are required to make contributions. So I just wanted to kind of point that out. And our income standards actually have increased effective March 1st. So this presentation does have the income standards from last year, but they did increase slightly. HIP 2.0 kind of builds on the original Healthy Indiana plan that started back in 2008. It is based on similar to a high deductible plan in the private insurance market, where individuals actually pay into a power account, which is similar to a deductible, and that the amount, those contributions they pay are actually theirs, and so their first $2,500 in medical expenses are actually paid out of that power account that the member and the state contributes to. And after that power account is met, then the state would pay for claims through its normal process. And there are three managed care entities that provide coverage. That's Anthem, MHS, and MedWise. And so those are our three managed care plans, both for HIP and the Hoosier HealthWise.
Sherry?
And there are incentives for individuals that may have some amount in their power account in the next year that can roll over, and also some individuals may receive certain preventative services, and that could actually reduce that individual's monthly contribution in the next year, and it could actually be reduced to $0 and still get coverage in the Plus plan. And some basic changes for 2015, under our previous HIP 1.0, there was a maximum number of individuals we could enroll based on the funds that we had available, and we enrolled a little bit over 60,000 individuals prior to June of 2014, when we had to suspend our enrollment again for the Healthy Indiana plan. And also, there are no maximum annual expenditures or maximum lifetime benefits. There's no longer a cap, so individuals would continue to receive coverage despite how many medical claims that they may have, as long as they're eligible. HIP 2.0 does have what's called a power account, and that's where the member and the state contributes monthly contributions to this power account, and for HIP 2.0 it's $2,500. Under the original plan it was $1,100, but it acts the same way as previously, where a family individual would pay approximately 2% of their income into that power account each month. For individuals that do not have any income or have very low income, there still is under the Plus plan a requirement to pay at least $1. For individuals that have rather large-sized families but have income that may be greater than most families, we do cap the monthly contribution at $100 per month. So there could have been some families that actually would have contributed more than that based on that 2% of their income. But we suspect most individuals will probably have contributions in around $30 or less per month. There are some penalties that individuals may face if they do not make the power account contribution. So we do allow a 60-day grace period if the individual does not make the contribution by the original due date. And so individuals that are actually at or under 100% of the poverty level, they can choose not to make the monthly contribution. And if they don't, they would not be eligible for the Plus plan, but they would be defaulted to the basic plan, which does not cover like dental and vision services, and individuals would be subject to copayments for most of their services. And once they are, and if they don't make that contribution and defaulted to the basic program, they couldn't buy up into the Plus program until their redetermination. And so for individuals that actually have income above 100% of the poverty level, they are required to make that contribution, and the only plan that they could be eligible for is the Plus plan. And if they do not make that first contribution after they're found conditionally eligible, and they don't make that contribution in 60 days, their application will be denied. For individuals that have made their first contribution, but then later on fail to make another contribution within 60 days, and if their income is over 100%, their HIP benefits will be discontinued, and then they will face a lockout period, which means that when they try to reapply, they wouldn't be eligible for HIP until after the 6-month penalty period. And so if the individual just fails to make their first contribution but never had any coverage under HIP 2.0, after 60 days, if they're over 100%, they would just be denied, and those individuals could actually then reapply without having a 6-month penalty period. And there are a few exceptions For individuals that are determined medically frail, for individuals that are living in a domestic violence shelter or have been subject to domestic violence, or if the individual lives in a state-declared emergency disaster area, then those individuals would not be subject to that 6-month lockout period. Here's just some basic information about who can be eligible for the Healthy Indiana Plan, and I apologize that the slides have not been updated for our income standards for March 1st. So actually for one person in the household, I believe the income standard is now $981. So individuals do have to be residents of Indiana. Most individuals do have to be between the ages of 19 and 64. We do have one exception for our low-income parent caretaker group. Those individuals could actually be 65 or older, as long as they are not receiving Medicare. Those individuals could actually qualify under the HIP program. The income standard is 133% of the poverty level, and we basically say 138% because there's a 5% income disregard. But that income disregard actually makes the effective poverty level about 139.5% of the poverty level. If individuals are eligible for another full coverage Medicaid program, so if the individual is actually eligible and enrolled, let's say in Medicaid for the disabled, that individual cannot be eligible for the Healthy Indiana Plan. Individuals also that are eligible and receiving Medicare are not eligible. And we did, in January, we did transition several over that were receiving traditional Medicaid under our Package A program. We actually transitioned those individuals to HIP 2.0, and that included our low-income parent caretaker groups and also our low-income 19 and 20-year-olds. We're also still in a transition for individuals that were receiving only family planning services. Those individuals that had income at 133 or below. So those individuals actually have an opportunity to make their first contribution to transition to HIP 2.0. And if those individuals are under 100%, they'll be transitioned to HIP Basic. And there's just the basic information, the household size from 1 to 4, the monthly income levels for a HIP at 138% of the poverty level, and then we're also showing at 100%. So if the individual's under that 100% that and do not make a contribution, that they can get the basic benefits. So we are trying to encourage individuals to make that first monthly contribution so they can get into the HIP Plus program, which does offer additional benefits, mainly vision and dental services, and individuals basically pay that modest 2% contribution instead of having co-payments for all their services. And we look at HIP Basic more as the default option, which has less benefits, no vision, no dental services, but is only available for those individuals underneath the poverty level. And there are co-payments for almost all services, and that is a co-payment per service, not like per day. And those co-payments do range from $4 all the way up to $75 for an inpatient stay at a hospital. HIP State Plan is available for individuals that are determined medically frail, and it's also available for those individuals, the low-income parent caretaker group and the low-income 19 and 20-year-olds. So those groups that transition from the traditional program into HIP, if they continue to maintain that low-income parent status, that they actually get HIP State Plan benefits. And so those are the equivalent benefits that they were receiving before under Future HealthWise Package A. What's different here is the cost sharing. So individuals that are on HIP State Plan Plus, they make their monthly contribution. and there's also HIP State Plan Basic, and that's for individuals that have co-payments for all their services. But the benefits, the actual benefits are the state plan, basically package A benefits. It's just the cost sharing that's different for this group. HIP Link is the employer-sponsored health insurance that we hope to implement sometime in June or later. And this is where employers would pay at least 50% of the employer premium for their health insurance, and the state would pick up the remaining half. And the individual member would still have to meet all the eligibility requirements for the Healthy Indiana plan, except if they wish to participate in HIP Link, they would actually pay their 2% contribution to the employer through a payroll deduction. I talked a little bit about some of the different unique populations. So individuals that are medically frail, these individuals will actually receive the state plan benefits, and their cost sharing could either be basic or plus. And these individuals cannot be locked out of HIP Plus if they do not make a contribution on time. So their coverage would actually continue as long as they're under the 133% income standard. On our Indiana application for health coverage, that's the application that the Division of Family Resources uses to determine eligibility for Medicaid and all health coverage programs, including HIP. There's a series of questions that an individual will answer if they have any, and if they answer yes to any of those medical questions, they would be temporarily enrolled into the HIP state plan benefits, and then that information is transmitted to whatever managed care entity they selected on the application, and that health plan, that MCE, would confirm if that person is in fact medically frail, and they'll look at claims information, they'll look at prescription information, they may contact the member directly, or they may contact the physician just to try to confirm if that person does meet the medically frail criteria. Pregnant women that are pregnant at the time they apply for coverage, they actually have to be put into the Medicaid pregnancy category. But an individual that's already in the Healthy Indiana plan and then becomes pregnant, she would actually remain on the Healthy Indiana plan, but she does also have the option to move out of the Healthy Indiana plan back and to receive Medicaid pregnancy coverage. The benefits will be the same, basically equivalent, whether she stays in HIP or whether she decides to go to the pregnancy category, because if she is pregnant, she will receive enhanced services under the Healthy Indiana plan. Native Americans are actually exempt from all cost sharing. So currently, individuals that have verified Native American status will be placed into our HIP Plus program without any cost sharing, so they would not have to make a contribution to the power account. And then effective April, these individuals will actually have the option to move out of managed care and receive benefits on a fee-for-service. And then our transitional medical assistance group is for those individuals that were low-income parent caretakers that get an increase of income that no longer make them eligible under that designation, and then they would actually be eligible for HIP benefits under HIP state plan for at least a 6-month period with an additional 6-month possibility depending on what their income is during that second 6-month period. And I talked about before about the low-income parent caretakers and 19 and 20-year-olds, that those individuals will receive the state plan benefits. And here's this basically information I talked about, kind of comparing the plans between HIP and Plus and HIP Link. It talks about the monthly contributions to the power account under HIP Plus and under HIP Basic that members will be responsible for co-payments for most services.
We see a lot of questions coming in, so as soon as Matt is done with this part of the presentation, we'll try to get to all those answers, or questions, sorry.
And I'll just kind of skip over this. It's a very basic how to apply for the Healthy Indiana Plan. You apply through the Division of Family Resources, through the FSSA. They have a portal online where an individual can apply directly online or can print off an application that is barcoded specific to that member, and that can be faxed or mailed to FSSA. And there is also an option to do a telephone application. We don't encourage a telephone application because it can take approximately about 45 minutes to complete on the phone. And we do believe the online application is the best option. Most individuals actually choose that option. And here again, just comparing HIP Plus to Basic, that we do want individuals to try to make that first contribution and continue to make their contribution so they can get additional benefits in HIP Plus and actually not face the co-payments. And I'd already talked a little bit before about the HIP state plan benefits. So those groups, the low-income parent caretakers, the transitional medical assistance group, and the medically frail will get the state plan benefits. It does include transportation services and the dental and vision services that were available under the Hoosier HealthWise Package A. The only difference is if a person makes a contribution, their cost sharing is a contribution under Plus, and under Basic, they're making co-payments. Here, if you just want to take a quick look at the different groups and what type of benefits they may be eligible for and the cost sharing. And then we have special provisions for individuals that are 19 and 20-year-olds. And also some provisions for pregnant women and the Native Americans. And I can make all these slides available. Jenny could probably send these out. And I actually have 5 different presentations, and all of those can be made available to you.
We'll have this posted in about a week or so on the IRHA website. And if you have any questions about that, you can always email us for additional slides that Matt has sent us. But this will be posted because it's being recorded on our IRHA website in about a week.
And here's just a comparison about some of the basic benefits provided under HIP Plus, HIP Basic, and HIP State Plan. And if anybody has any questions about the different benefits covered, I may not be able to answer those, but I'll definitely take those back with me, especially if they're not mentioned in these couple slides I have here. You can see that transportation is not a covered benefit under either HIP Plus or HIP Basic, but under the HIP State Plan, non-emergency transportation is covered. The health plans, however, can decide to provide enhanced benefits, and I believe that Anthem at least has decided to cover non-emergency transportation under HIP Plus. And I've pretty much already explained about the power count, so this is kind of a recap. The individuals, they'll have at least a $1 per month contribution. Something else, if there is a married couple in the household, they would actually share the 2% contribution. So if the total contribution was going to be 2% of the person's income resulted in a $20 per month contribution, and both spouses are eligible for the Healthy Indiana Plan, they would share that $20 contribution, and they would each get an invoice from the plan, and they would each pay $10 each. If the contribution, if the person has no income, and so the contribution, the minimum would be $1, and actually we can't split that $1. So in that case, each spouse would actually be responsible for a $1 per month contribution. If a person does leave the plan early for whatever reason, they're discontinued, perhaps because they no longer meet the income level, they may receive some of their unpaid contributions back as a refund. Again, here's a comparison between HIP Plus and HIP Basic. We encourage individuals, again, to try to buy in, make that first contribution to get those additional benefits. As you can see, the two examples there where a person may be entitled to a rollover at the end of the benefit period where their next year's contribution may be reduced. And so even an individual that's in the basic program at redetermination can decide to make that first monthly contribution to get into HIP Plus. So that individual actually, if they receive preventative services in the previous year, could actually get that contribution reduced. What's important here is previously employers could contribute under the original HIP plan 50% of a member's contribution, and nonprofits could contribute up to 75%. So those restrictions have actually been removed for HIP 2.0. So actually employers, nonprofits, and actually other entities, including providers, can pay up to 100% of a member's contribution. And so for individuals that may have trouble making the contribution, that assistance from these entities can be made up to 100% now. And then the bottom of the slide just gives you an estimate what a member's contribution may be based on the income level. Here again is a little bit of information about the non-payment penalties. Individuals under 100% that are making contributions and receiving plus benefits that do not make the next contribution within 60 days they'll be moved to HIP Basic. They will not be locked out. The individuals above 100% who do not make the contribution within 60 days will be disenrolled from HIP and have that 6-month lockout period. And I talked a little bit before about the exceptions for non-payment, and also Native Americans do not have any contributions, so they wouldn't even make a contribution. They automatically get HIP Plus benefits. And those individuals that are medically frail that do not make their contribution will continue to receive coverage. And those individuals under 100% will not face a penalty period. Under the HIP Basic plan, there are copayments for most services, and they do range from $4 up to $75. For a non-emergency visit, it's up to $25. So for the first visit, it would be an $8 copay. For the second visit, it would be $25. We've actually been required by CMS to do a study on the non-emergency ER visit copayment. So we actually have a control group that will just only have an $8 copay for each non-emergency ER visit. And I'm just going to go through these slides very quick because we're running out of time. I just want to point out that contributions, they're not premiums, so that individual actually owns those payments and could actually receive those back if they leave the plan early, and that amount can also roll over to the next year to reduce their contributions. Individuals that make contributions or co-payments, there is a 5% income limit that individual may pay. So if the individual has a co-payment of $75, that may meet their 5% of their income limit, and we would actually have to shut off the cost sharing for the rest of the quarter. And HIP link, I'll have more information about that hopefully in the June time frame, and I'll try to pass that information along to Jenny. And so hopefully you learned a little bit about HIP Plus, HIP Basic, and HIP State Plan. So I guess I can start taking some questions.
Well, actually,
I'm sorry.
It's okay. Well, since we have so many questions, I know rolling in, we'll go ahead first and I'll cover the last part of the presentation, just giving you some information on how you can receive some assistance, how we're available, when we're available, things like that. Okay. Give me just a second. Okay. All right. So for enrollment and outreach events, I wanted to cover some information regarding questions we received, like what does a typical enrollment event look like? ASPIN, along with a couple of navigators from IRHA, are teaming up to try to get as many people enrolled in insurance as possible this year. So we come out to your location, and our assistance is absolutely free. You can schedule it however you would like to schedule it with us. It can look like a half day or a whole day. It can be multiple days if you think that there's a need for that. We'll just have to know in enough time so that we can schedule the navigators to come out to that location. Like I said, we do come out to your location. We're really just a traveling mobile office, so we have computers that we bring, our laptops, and all the information, our scanners that we need. We bring literature. So you don't really have to do anything if you need our help with enrolling people. And this is in Marketplace and in HIP. We can do both. And obviously, if they are eligible for Medicaid at that time, we enroll them in Medicaid as well. So we're a traveling little mobile office that comes out to your location, and we set up wherever you think that the best location is. And the best part is it's absolutely free. Applications typically take anywhere from, 15, they can be quick, 15, 20 minutes, all the way up to an hour, depending on the situation that the person is going through at that time, and all the information that they have brought with them, how easy it is to, access their account and everything else. So what you need to provide for us is essentially just the tables and chairs, and we do the rest. Any help that we can receive marketing and advertising of the events is essential. We've had several events that have been extremely successful, and that has been because the organization has advertised it in the newspaper, radio, news stations, websites, social media, partner websites, press releases, and they've also posted signage. We do have posters we can send you as well to advertise the event. So we can help with all of this. The key to a successful event, we found from our experience, is just collaborating with community partners to make sure that the word is out there. So especially right now, maybe those that serve a lower income population that might qualify for Medicaid or HIP, since that's, we can do a lot of enrollment in right now. Partner with those organizations that see those populations and get the word out to them so that they can send those individuals to us wherever we are at. So if you want to schedule an event, you can either call ASPIN. Shannon, like she said, she answers a lot of the call center. Shannon, I didn't put your information on here directly. I didn't know if you wanted me to or not, but I can pass that along to Shannon. That is my information there. I'm Jenny with the Indiana Rural Health Association. I am a certified navigator that does go out and travel with other ASPIN navigators to enroll individuals in HIP, Medicaid, and Marketplace. Questions about HIP specifically, you can contact Matt, and there is his email. So after this is all said and done with, if you have people who are listening into the recorded webinar, they can feel free to contact us with any questions that they might have. But I just want to stress that we are still doing enrollment events and outreach events all the time. We can come out and do a presentation similar to this if you would like, or base it on what your needs are. So we're free to come out and do that however you would like and whenever you would like. So I have a question that says, so they're going to use the 2015 federal poverty level, correct?
Effective March, from March eligibility and ongoing, we will use the 2015 poverty standards. So some individuals that were determined eligible in February, those standards have been updated now. So it is potentially possible someone could have been over the income standard in February. If they're very close, they may want to reapply based on the changes in the income standard. And we understand the marketplace probably started using the standards in January, I assume. But we always, when the poverty levels are published in January, we usually update our standards March 1st.
It says, how quickly is that change in the plan, plus basic, et cetera, noted in the system?
It's in our eligibility system now, so the caseworker may have to run the case in the eligibility system, and that would form, that would change that person's, it would change the income standard that person's being compared to, but it wouldn't change the person's contribution, because the contribution is still 2% of the poverty level. It would just affect the individual if they're under or over 100%, or if they're still under the HIP standard 133. So but it doesn't change the person's contribution amount.
It says a navigator recently reported that a former family planning consumer made her PAC on February 23rd, but was informed that her coverage does not start until April 1st. Can you shed some light on what the issue may be for this former family planning consumer?
For our family planning group, it was a little bit different. We do require that person to make that first contribution. But if they did actually pay it in February, normally for an applicant, they would get coverage in February. But for family planning, we extended the eligibility for family planning a month. So if they actually made that contribution in February and the plans have indicated they made it in February, the coverage for family planning should actually start on March 1st. And so I'm not sure why it's starting on April 1st. If you could send me the specifics on that, the case number or whatever information you have, if you have case-specific information, and I can take a look at that back in the office next week.
Says, how does a person who is already on HIP or HIP Plus get qualified to receive medically frail benefits? I have clients with this issue.
Okay, if the individual didn't indicate on the application that they met one of those criteria, they won't get that temporary status. And if they transition from HIP 1.0 and HIP to 2.0, and they weren't in that enhanced services program, the ESP program, so the plan will make that determination by looking at claims. So the plans are required to make continuous determination under the medically frail group. But if that individual believes they are medically frail, they could contact the plan directly, and they can actually start to do that medically frail determination. If a person is receiving Social Security disability benefits, they automatically meet that requirement. So so the Division of Family Resources at this point, if it's after application, cannot do anything about the medically frail status, so that individual can contact the plan and indicate that they think they're medically frail, and then the plan is responsible for trying to confirm that.
Says if clients receive multiple services in one day, is a copay required for each individual service?
It is, yes. It is subject to that 5% limit, however, but we may not know that 5% limit after the claims have been adjudicated, but it is for each service.
Says with HIP Link, will the consumer have a HIP Link member ID card, or will they have an ESI member ID card?
I think that's still to be determined. I believe they probably will get a special HIP card, but I believe they'll also still get a recipient ID number. But that's still being developed, so I don't really have any more information at this point, but hopefully I will in a few months.
Can CMHCs make the power account contributions for individual clients?
Yes, they can. The only thing I can say is that they cannot require that member to come receive services through them. So they may want to just look at the law just to see if there's any conflicts of interest in making that contribution. And what we see is that they would be allowed to do that as long as they don't require that member to seek services through them.
Okay, yeah, I have a question about whether I can get these slides to individuals for their individual purposes, and absolutely, please email me, jhill@indianarha.org, and I will get this information printed and sent out. If that's what you would like, I can just send it to you email, and you can print out however you want. And there's also other resources that Matt has sent me and I have from Shannon that I can include. Okay, any more specifics about what type of dental vision are covered as far as dentures, extractions, percentages? Is it the same percentages if on HIP Plus?
I'll have to go back to get that information, and I can provide, I believe, a document that has a comparison. The benefits under HIP Plus, the dental benefits are less in most instances than the HIP state plan. But I'll try to get that information. I can send that through Jenny.
Is there more information on guidelines and procedures available for nonprofit organizations interested in paying all or part of a consumer's cost-sharing amount?
I'm not sure what other information you would need. You may want to contact the plans directly because they do have special forms that they use because they are trying to track to see how many organizations do participate in providing contributions. They do not have to use these special forms, but I know they do want to track that. So if you know what member, what plan the member's chosen, I would contact the plan or have that member contact the plan just to see what form that they have, just to make sure that that contribution is received for that member by using that special form. So, and to make sure that the funds that are being sent, that they know it's for that specific member. So I would contact the plans directly on that.
And as far as the insurance for the dental, I will say from the information that I've seen during enrollment and comparing that it is, even though it might be less than maybe normal insurance plans or corporate, it looks really good to me as far as what's covered. I mean, at least they're getting quite a bit of help, and we can send that information to you. But I know I've seen it's pretty comparable to maybe what like our employer insurance might offer, maybe just a little bit less. What methods of payment for consumers are available?
Of course, by mail. Check is probably the most commonly used. The plans do also have to accept payment by phone. They actually do not want to accept cash through the mail, so we don't advertise that, but if it was received, they are required to accept that. We're working with Walmart right now to try to have contributions paid through Walmart, so they will not even charge a service fee for that. So that is available in one, I think MD Wise, I think has that available currently, but I think there's like a 99-cent or 89-cent service charge. So the state's trying to work with Walmart to try to get that free. And also one of the other plans uses Fifth Third Bank. That contributions can be made through them. And also Western Union does take contributions, but currently there is a service charge that can be rather large. So we are looking at more methods to try to do this free, and the Walmart seems to be the best option right now. We will be adding to our application what's known as Fast Track, where an individual can actually get coverage, can actually make a payment prior to them being determined eligible for Healthy Indiana Plan. So based on the application, the DFR enters application information into the system, and actually within 5 days, we're going to send that information to the plan. And so they'll actually send them an invoice even before the determination is made by DFR that they're eligible or not. They'll be sent an invoice, and that this fast track payment would be a $10 one-time payment to kind of preserve that eligibility, so they actually make that payment before they're determined eligible. And if they are determined eligible by DFR, that coverage would actually go back to the month they made that contribution. We're also updating our online application with credit card information, so an individual can actually make a payment by credit card on the day of application. And if they are then found eligible for the Healthy Indiana plan, that coverage would go back to that application date. So CMS is, since there's no retroactive coverage in HIP, CMS has asked us to do this fast track eligibility to try to delay coverage, to try to not delay coverage until they're actually determined eligible, but actually make that payment up front.
And to kind of add on to that, I know whenever we're enrolling individuals in Medicaid, this isn't HIP necessarily, but Medicaid, their coverage can become retroactive for up to 3 months. So if they become eligible for Medicaid and they've been seen at a doctor prior to being approved for Medicaid, there's a good chance that they can get those bills paid for. So the question is, what contingency plans does the state of Indiana have should the Supreme Court rule against subsidies to be allowed for the federally facilitated health insurance marketplace in King versus Burwell? I don't know if Matt and Shannon want to kind of both handle this, or
Yeah, I guess I probably can't comment because I don't believe it's going to affect the Healthy Indiana plan. It's going to basically affect those individuals that have received subsidies. So I'm not really sure. I know the state legislature actually looked at potentially trying to set up a state-based exchange to maybe try to avoid that in the future. I believe the administration, though, wants to continue with the federal marketplace and not establish a state-based exchange. How it's going to affect the Healthy Indiana plan, it won't. And so I really can't comment how it's going to affect marketplace individuals.
Shannon, do you have any information on that?
This is Julianne. We don't. We're waiting to see, but CMS hasn't given us any information. I'm sure they will as soon as the decision's made. But we're not speculating. We're just moving forward the way things are.
Right. So next question is, if a person misses their initial contribution but paid within 60 days, do they pay 2 months or just one?
They could actually just pay, if it's within that 60 days, they could actually just pay that 1 month and would get coverage. So an individual could have a gap of 60 days, and so they can be continuously behind in their payments 60 days and still maintain coverage, and they should not be discontinued or put in the HIP basic as long as they make that a contribution within 60 days.
So it says, is it due on the first of the month, and how can it be where?
The plan will determine the due date, and so the original date. So the plans actually determine that 60-day period. So if there's any questions about what they think, if they're unclear what that last day is, to contact the health plan.
So I'm dealing with consumers that have income issues applying for HIP. If they are paid 3 times in 1 month instead of 2, they are shown to be over income and we're told to reapply the next month. Another consumer is laid off during the summer, so her yearly income reflects eligibility for HIP, but her current monthly income does not. Let's see, Marketplace set her to HIP due to her yearly income, but HIP says she's over the income due to her monthly income. Is there a way to help these consumers receive HIP benefits?
The state of Indiana does use the monthly income amount, so we don't use the annual amount, what the marketplace uses. We actually look at current income when they apply. So that there will be some differences where the marketplace may think that they're eligible for HIP, but they're actually over income in that month. And also, we don't use IRS tax records as a for verification of income. We do use electronic data sources from Social Security and we also use the work number, which provides some information about some employers. Otherwise, if we can't verify electronically, we do require paper documentation. So there are instances where the marketplace will say that they're eligible for HIP because the marketplace is using an annual income, but we do use that monthly income, and we convert all income to a monthly amount. So if a person does have like 3 paychecks in 1 month, we do look at that monthly amount, but the workers do have the option of using different budgeting methods. They can use like an averaging budget method. They can use some skip methods. So I would point that out to the worker, that there are other budgeting options that they can use, like to average the income, and that is an option, and that information is in our policy manual. So that could potentially make some individuals eligible using that averaging income. Unlike the former Healthy Indiana plan, where an individual could maintain benefits for 12 months that they weren't required to report changes, since we've integrated HIP into our Medicaid hierarchy, individuals do need to report any changes of income that may affect their eligibility, or any changes in household size. So that can affect an individual's eligibility for HIP on a month-by-month basis. And it could also affect their power account contribution. It could also affect if they're over or under 100%. So we will have some individuals that maybe discontinue because they did get an increase in income, but then maybe later lost that job or had a decrease, and they would need to reapply in that instance. So there are going to be some differences between the marketplace determination and then what the state determines.
I think that it's just important to note what Matt said, just make sure that they're aware of the different budgeting tools that are out there, and you can contact us if, that the organization that's working with those consumers, can definitely get a hold of us, and I think Matt would be more than happy to help them figure out the tools to use to get them the insurance that they need.
Yeah, and I do get some inquiries from different organizations and navigators. And usually I'll do a quick look at the individual's eligibility case, and if I do see something that DFR has maybe done correctly or could do better, I do refer those to the DFR deputy director, and she usually has her staff look at those. So I do a quick look at the cases, or my staff does, and then we do send for a DFR if we think there is an issue that person probably is potentially eligible, or whatever the case may be.
Because when ASPIN comes out to an enrollment event, how many navigators/workstations do they send out? This may affect the length of our event. How much of a heads up does ASPIN require when planning the event? Julia might want to add on, but I know for us when we go out, the more time you give us, the better, so that you have time to advertise and get more people there. However, we've gone out, I know Dana and I, on just a short notice, a week notice or so. When we come out, just let us know what type of audience that you think that you're going to have. So that way Julia and, IRHA, whoever you contact, can work together to decide how many navigators to send out. So for instance, a hospital in Connorsville contacted us, and they wanted to have an event there, and they're making a pretty big production out of it, having a reception with appetizers and things like that for individuals. So they know that there's probably going to be a big draw. So that they assumed that they probably need to give us a separate room where it's pretty private for us, and request about 5 navigators total, just so the event, there's not long wait times for individuals signing up. So really it's up to you what you think that you need, and then I think that they just will work with us or Julia to determine, how many can ASPIN send out, especially based on the location. So if it's 4 hours away from Indy, we might be limited as far as how many navigators are available to come all the way there, but we'll definitely try to fit your needs however possible. Julia, do you want to add anything?
Yeah, and ASPIN has navigators all over the state, and a couple of weeks is good to set up, because we do have things already on our calendar, and you can go to our website to see that we have events. So we might have an event in your area, and we could build on that event. But some other things we do, we have Spanish-speaking navigators. So if we need to have some bilingual navigators or some translators there also, we can set that up too. But we have events, like Jenny said, from up to, it's usually up to 5, and if it's a bigger event than that, then we'll pull in some other folks and call some other partners in to help provide navigators. So we'll work with you, and you'll probably call, to work with us, call our call center number, and Shannon can help set that up.
Says, what document is normally received that reflects Native American status?
For the Native American status, we do need to verify it. So some common Native American status verifications that we would use could be a tribal card, or it could be a letter from the tribe indicating that individual is a member of the tribe. We also do allow, so individuals that actually are eligible for or received a service for like an Indian health center, they would automatically meet that requirement. So if they didn't have a tribal card or they didn't have a letter from the tribe, but they could show that they're eligible for those services, or maybe have a receipt from the Indian Health Service that they received a service, that would also meet that requirement.
How quickly is interchange updated when a member defaults on their HIP Plus Power Account contributions to know that they are now HIP Basic?
Well, first of all, the health plan would send what's called a no-pay record after that early 60 days has expired. So they'll send a no-pay record to the claim system, and that claim system sends that to what's known as ISIS. That's the state's eligibility system. So that would trigger in our eligibility system to look at to see if what that person's income level is when we get that no pay record. So if they're at or under 100% and that no pay record is sent, that person will be transitioned to HIP Basic. If they're over 100%, that person will be discontinued. But we have to allow what's known as adverse notice. So the Division of Family Resources has to give at least 13 days advance notice before a person's coverage is reduced, like we're going from HIP Plus to HIP Basic, or before it's discontinued. And so whenever, there may be a delay actually from DFR if they delay a couple days to take action on that change, because we have to give 13 days notice. So that eligibility would not change to basic, or would not change to be discontinued unless they're given that 13 days notice. So it could be that next month. So if that no pay record is, let's say it's sent on March 10th, and DFR takes action on that on March 11th. So then that person's coverage, if they're under 100%, that their coverage actually could change from HIP Plus to HIP Basic, but not until at least April 1st. And so also if that person was over 100%, that in this case, that person's coverage would continue through the month of March, but would be discontinued effective April 1st, as long as they're given that 13 days notice.
I just shared our screen again with the email addresses and contact information, the call center for ASPIN. My information right there along with Matt's, because that was requested again. So hopefully you guys have a chance to write that down. And again, just email us with any questions or feel free to call us. Lots of challenges with HPE eligibility. Any updates?
There have been some issues with HPE. There have been some issues about providers and hospitals, and I guess our enrollment broker, Maximus, understanding really what's covered under HPE. If a person is eligible under the adult HPE group, that is basically the HIP population. They are eligible for services other than hospital services, and it is coverage that's very similar to HIP Basic. So an individual wouldn't even necessarily have to even go to a hospital to get coverage reimbursed as long as they're eligible for the HPE period. If a person is found eligible, once a person is found eligible for full coverage, then we don't change that we wouldn't end the HPE coverage retro. So if a person has HPE coverage and is then found eligible for full coverage HIP 2.0 because they did the actual full application, that HPE should continue to the end of that month, and then that full coverage Healthy Indiana plan should pick up the next month. And if a person does currently have family planning HPE, that will prevent that individual from receiving that full coverage. So if they make their contribution, let's say today, but still had that family planning coverage under HPE, the HIP coverage actually would not begin to that next month.
Okay.
If you have specific concerns, if you're having like provider issues indicating what's covered under HPE, if you think you're being provided incorrect information, or if you have a specific case where you think that person didn't transition correctly, you can send that to me, because I can't really address everything on this call, but if I had some case specifics, I could try to address that with that correct person. So.
And again, regarding dental information, just please email me, jhill@indianarha.org, or call me or email Matt. His email is matthew.cesnik@fssa.in.gov, and we can answer those questions. Jim Miller wanted just to make a comment. I think that a bill 417 to establish a state health insurance exchange never received a second reading and died in the Senate Appropriations Committee. So hopefully more information forthcoming. Hopefully some good things will start coming out, but we will keep everyone updated, and we're hopefully going to have another webinar. So there may be 12 individuals with a completed paper application next week. Would it be efficient to mail those in together? Is there any delay in processing since it is not online?
The applications are bar-coded, so if they are faxed or mailed in, even if they're together, they should be able to separate them. But I would still send those separately, whether by fax or mail, just because a page may get mingled in somehow. I've always, when I worked for IU Hospital, I always sent them separately, and I think that's a better route.
So do I understand that fast-track payment would get people covered earlier, for example, waiting until the following month for coverage after determination?
Correct, but that coverage won't start till DFR actually makes that determination, but it will go back to that month, made that contribution, yes.
I believe that's all of our questions. And if you have any more that we did not answer, or you would like to send us privately, again, email jhill@indianarha.org. You can also call 812-478-3919, extension 225, or email Matthew at Matthew, mattcesnik@fssa.in.gov, or you can contact ASPIN at 1-877-313-7215. All right, well, thank you, everyone, for attending the webinar, and we hope that you found this useful. Please contact us if you need further assistance.